As the opioid crisis continues and thousands of Americans die from drug overdoses, the focus is turning to the solutions that could change the course of this dangerous epidemic. RT's Rachel Blevins has the story.
Last year was the worst year on record for drug overdose deaths in the United States, and with 2/3 of those deaths being linked to opioids, it has raised questions about whether we can stop this epidemic before it is too late. Nearly 200 Americans died from drug overdoses every single day last year. The number skyrocketed from 64,000 deaths in 2016 to more than 72,000 people killed in 2017 alone. The epidemic has gotten so bad that drug overdoses have been labeled as the leading cause of death for Americans under the age of 50. Deaths from alcohol are also on the rise, with a 35% increase in the last decade. And while alcohol-related deaths increased 29% in men, they went up an alarming 85% in women, signaling a disturbing new trend that is concerning many health professionals. This leaves us with the question, what solutions are there to combat this addiction-fueled crisis? After a record number of opioid overdose deaths last year, Ohio's medical board is now considering using cannabis as a treatment for chronic pain and opioid addiction. Some patients have also claimed that it wasn't until they began using supplements from the plant kratom that they were able to manage their chronic pain and kick their addiction to opioids altogether. The addiction treatment company BioCore RX is also seeking approval from the FDA for an implant that would release the drug naltrexone into the bloodstream. The drug acts as an opioid antagonist that can significantly reduce physical cravings for alcohol and opioids. Patients who participate in the program would follow up the implant with counseling sessions focused on treating their addiction long term. Now, it is no secret that the opioid epidemic in the United States is at an all-time high. But with the focus on finding methods for this dangerous addiction that thousands of Americans are currently battling, there is hope that we could eventually start to see some progress. In Washington, Rachel Blevins, RT.
For more, we turn to Dr. John Dombrowski, a pain management doctor and anesthesiologist here in Washington, D.C. Dr. Dombrowski, thank you for being here.
Thanks, sir.
Now, let's start with, how does this drug reduce these cravings for opioids and alcohol? What happens if you were to use drugs or alcohol while receiving the treatment?
So here you go. So this medication, which is called naltrexone, has been around since the 70s, and it's usually an oral-based medications. Really, back in the 90s, we started to realize that patients who wanted to abuse alcohol or wanted to abuse opiates really weren't too compliant about taking their medication. So we now came up with an implant where it insert inside the skin. So basically, it blocks the chemical need to use, that physical craving I need to use to feel better or to get my high. It sort of blocks that, so it helps you with your sobriety.
And what is the significance in the fact that it is an implant and not a pill or another form of medication?
Patient compliance is 100%. So this way, if I have to take a pill, I may forget it, I may not want to take it because I want to get high or I want to use. Just like women in birth control, they would have to take a pill, but then they came up with a Norplant that they would place underneath the skin that would, prevent pregnancies for several months. It's a similar idea, so patient compliance goes up significantly.
Now, medication, medical supplies can be very expensive.
Right.
What is the cost of this, and how accessible is this? Does health insurance cover it at all, or what are we seeing here?
Well, right now we're working things out, and I think one thing you should think about is the overall cost of addiction. Right now, if you go to a rehab program, it's 30 days, maybe $30,000 to $50,000. The chance of sobriety after 1 year is 20%. If you do implant therapy along with the talk therapy and the psychosocial support, it goes up to 80% success rate. So that's really the main thing. It probably fits in around about a $10,000 fee right now for the medication and the counseling all in. And we're kind of looking this as probably an insurance policy so the patient doesn't relapse. And these are for patients that chronic relapse. I just did a guy yesterday. He was 31 years old. He had 10 relapses.
Wow.
So this way it kind of prevents that from happening.
Well, hopefully the cost will go down.
Of course.
I want to ask you, how crucial is the counseling as a component of this type of treatment?
I think we found out a couple of things in terms of sobriety. The first part is just a 12-step program, AA. Sometimes it works for people, sometimes medications, but we find out the best success is when you do both together, and it is crucial. It's not, I take my medication, I don't need any help. That's not really true. Just like if you take a pill for weight loss, I'm sorry, you still need to go to the gym.
Yeah, you definitely need that kind of source for reliability as well. Now, what about the negative impacts? What can patients face when taking this treatment, and if they were to take, again, alcohol, or what are some of the negative impacts, if any, that have come up?
Obviously, the first thing I would think about in terms of negative is probably the cost, and then we've already talked about that, but it's also a surgical procedure. I mean, it's an in-office surgical procedure. It takes about 15 minutes to do. There's always chance of bleeding and infection, but that's with standard any type of surgery. Other things that if you were to use, you just don't get a high. And again, that's the reason why, again, you could drink alcohol, but you won't get that buzz or euphoria that you need that other drink. So that's kind of good. So it doesn't really make you sick like a lot of the other medications did. If you used opiates, you just don't get the high, so that's why I'm using the drugs, is to get a buzz. If I don't get it, what am I using it for? So that's, hopefully it gets the patient to reprogram their life. And it takes really about 6 months to do that. And sure enough, this medication lasts them about 4 to 6 months to keep them sober on that straight and narrow path.
Well, that sounds like a good alternative. I mean, with the opioid epidemic and so many drug overdoses and deaths in the U.S., I mean, we have to start somewhere. So thank you so much, Dr. Dabrowski, for being here.
Hey YouTube, thanks for checking out our channel. We hope you enjoyed the video. We have tons of content for you just like this. For more of RT America's one-of-a-kind news and analysis, be sure to subscribe and never stop questioning more.